Good afternoon, many thanks for joining us. I'll start as usual with a report on the COVID daily statistics. The total number of positive cases reported yesterday was 800. This is 13.2% of people newly tested and takes the total number of cases to 33,706. 303 of the cases were in Greater Glasgow and Clyde, 167 in Lanarkshire and 164 in Lothian. The remaining cases, 196 of them, were spread across 9 other health board areas. I can also report that 262 people are in hospital. That is an increase of 44 from yesterday, and 25 people are in intensive care, which is 3 more than yesterday. And I regret to say that 2 further deaths have been registered of people who first tested positive for COVID during the previous 28 days, and the total number of deaths under that measurement is now 2,532. That total reminds us again of the potentially deadly impact of COVID and why we cannot be complacent about it. And of course, once again, I want to convey my deepest condolences to everybody who has lost a loved one, and particularly to those who have been bereaved recently. I'm joined today by our National Clinical Director. He will say a few words shortly. However, I've just come from a meeting of the Scottish Cabinet where we discussed plans for responding to the continued increase in COVID cases. Now, let me say, first of all, Cabinet did not reach final decisions on any further measures this morning. Further work has been done throughout the day, and we will meet again early tomorrow morning. I will then make a statement to Parliament tomorrow when I'll give a more detailed update of the current situation and set out any decisions about further measures that we have reached and the reasons for them. But what I want to do now, given the entirely understandable public anxiety about what the next few weeks might hold, is try to give you an insight into the Scottish Government's current thinking and the issues that we are grappling with in coming to decisions. And perhaps most importantly of all, given talk of circuit breakers and speculation about what that might mean in practice, I want to let you know what we are not proposing to do at this stage, because I think that is equally important. I should say I gave the other party leaders in Scotland a similar update last night and took their views on the current situation. But first of all, let me reflect, and I want to do this as frankly as I can. Back in, April, I said that I wanted, as far as possible, to treat you, the public, as grown-ups and include you in the decision-making. It's not always easy to do that for a government, but I want today to be as frank and open as I can about where we are now and some of the difficulties that lie ahead for us. And after 7 months of decisions that have been extremely difficult for me and the government to take, and even more difficult for all of you to live with, I appreciate that what I am about to say might seem like a big statement to make. But in many ways, this is probably the most difficult decision point that we have faced so far, and I want to try and explain why that is the case. Right now, as our figures demonstrate, and like many other countries, we face a sharply rising rate of infection again. Not as sharply rising as it was earlier in the year, but nevertheless it is rising quite markedly. The situation, again, as you see from the numbers, is particularly pronounced in the Central Belt, in Greater Glasgow and Clyde, Lanarkshire, Lothian, and now too we are seeing evidence of that in Ayrshire and Arran and Forth Valley. But notwithstanding that it is particularly pronounced in the Central Belt of Scotland, it's important to recognise that cases are rising everywhere across the country, and levels of infection now in most parts of Scotland are higher than we can be comfortable with. Most parts of Scotland, and mainland Scotland in particular, have infection levels of higher than 50 cases per 100,000. And if you cast your mind back to the time we introduced a local lockdown for Aberdeen, the level of infection that triggered that was around 20 cases per 100,000. So that gives you a bit of context of the rising situation that we are dealing with right now. We're also now beginning to see spread from the younger age groups of the population into the older age groups. And again, as you've seen from today's numbers, the numbers being admitted to hospital and intensive care, and sadly the number of people dying, are also increasing. Now, it's important also to say, just for perspective and balance, that partly because we reduced the virus to such low levels over the summer, and partly more so perhaps because of the excellent work of Test and Protect, the situation is not out of control, but the situation is a cause of increasing concern. To give an illustration of that, 2 weeks ago when I announced in Parliament that people would not be able now to meet in each other's homes, we were seeing an average of 285 new cases a day. That figure is now 729. So that shows you, even in those 2 weeks, how the situation has accelerated. Of course, and this is an important point to stress, we've not yet seen the full impact of those household restrictions on our case numbers, and we are hopeful, very hopeful, that in the next few days, even without any further intervention, we will start to see these restrictions slowing the spread at which cases are rising. But we cannot guarantee that that will be sufficient. And the volume of new cases that we're now seeing, combined with the prospect of further increases, is the reason, and I want to be very clear about this, that the government is receiving very strong public health advice that action over and above the existing restrictions is necessary. And this is a point where I particularly want to level with you and just give you an insight into the decision-making process that we are going through right now. If this was a purely one-dimensional decision where the immediate harm caused by COVID was the only thing we had to consider, it is possible that we would now be moving in the direction of measures much, much closer to the kind of lockdown we had in March. But 7 months in, this can't be and is not a one-dimensional decision. It is very much a multi-dimensional decision. We have to carefully balance all of the different harms that are being caused by the pandemic. So that includes, obviously, the direct harm of the virus, which we must reduce. That bit is not negotiable. But also, we must consider the considerable harm that has been done to jobs and the economy, which, of course, we have limited power to mitigate, and which we know also have an impact on people's health and well-being. And we have to consider the wider harms to health and well-being that the virus and the restrictions deployed to control it are now having on all of us. And these wider harms weigh very heavily, and striking a balance that minimises all of them is not easy. After all, as I've said already, and as everybody knows only too well, we are now 7 months into this pandemic. We know that the ongoing restrictions have an impact on our mental, physical and financial well-being. And I think people, and I include myself in this, generally just find it much harder to cope now with the implications of it all than we did back in the spring. On the positive side, though, and again, I think it's important that we keep these issues in perspective. On the positive side, unlike in March, we now have Test and Protect. That is working well, and as intended, it is now taking a lot of the strain of controlling the spread of the virus. So we need to take all of this into account. And while, as I said at the outset, we haven't reached final decisions on additional steps we might take, we've got some further consideration to do. I hope it is helpful, in light of understandable speculation, for me to be clear about some of the conclusions Cabinet has reached about what we are not proposing to do at this stage, because of all of these different factors that we are weighing and taking into account. So let me be clear. We are not proposing another lockdown at this stage, not even on a temporary basis. We're not going to be asking you to stay inside your own homes in the way we did back in March. And while we have been asking people to think carefully about non-essential travel, especially overseas, and I would ask that again, and while restrictions on travel may sometimes be an option, may sometimes be necessary for hotspot areas, we are not about to impose travel restrictions on the whole of the country. We're not about to shut down the entire economy. We're not about to halt the remobilisation of the NHS. It is vital that our National Health Service is there for non-COVID conditions, as well as there for anything that we have to deal with in relation to COVID. And apart from the October holidays, which are already planned, we are not proposing to close schools, either wholly or even partially. So I hope all of that gives people some reassurance. However, we are considering, as I've indicated already, what additional targeted steps we can take over the next couple of weeks, in addition to the household restrictions currently in place, to further stem the spread while we continue to strengthen, which is an ongoing process, our overall resilience in terms of living with this virus. That is our testing system, which is working well, but we continue to strengthen it, and also making sure that around compliance with restrictions and with all of the facts, advice, the regulations that we expect employers to have in place, that all of that is working well. What further restrictions we need to do in the short term to help reduce the spread of the virus. And inevitably, I know we talk a lot, and I talk a lot, as does Jason and others, about all of the science here, and we will, if we announce further measures tomorrow, set out the rationale for them. But sometimes when we're talking about how to stem the spread of this virus, it is not complicated. The assessment we make has to focus on the kinds of settings other than our own homes where people are most likely to come together and either get the virus, or if they have it, pass it on to others. So these are the decisions we are considering over the course of the day, and we will set out tomorrow. Of course, in taking them, we're also mindful of the harm caused by isolation, in particular for people who live on their own. We are considering, given some of what I said earlier on, the extent to which any measures would have to be taken nationally or regionally, or perhaps a bit of both. And we're thinking of how we best mitigate the economic impact of any decisions we take, even within the limited powers that the Scottish Government has. So tomorrow's statement will seek to address all of these issues. Let me end where I started. None of this is easy. I'm not complaining about that. That is the job of government. But as I indicated earlier, in many ways, this is actually the most difficult decision point yet. When we took the decisions back in March that just focused on locking down to stop the virus, none of the economic and social harm had been done. We now have all of that to consider as well. And so these decisions have to be very carefully balanced. And I know that many of you will be thinking, for goodness sake, just tell us what you want to do. And many of you will be thinking, for goodness sake, just leave us alone. All of that is understandable. And I know that while we are considering these issues, the media speculation about what we might and might not do, which, let me say, is entirely legitimate and understandable, that is not a complaint. But that also, I know, contributes to a sense of anxiety. So what I've tried to do today is share more about the decision-making process, the factors we are trying to weigh, any conclusions we've reached so far, and what issues we are still considering. I hope that approach is helpful, even if it doesn't always provide the instant clear-cut answers that I know everybody is keen to have. But let me end on this point. Whatever the future holds, one thing will always be constant, and that is each and every single one of us has power over this virus. And the best way for each and every single one of us to exercise that power every single day is to abide by all of the rules, regulations and guidance that is in place at any given time. So as usual, just let me close with a reminder of what those are right now. None of us should be visiting each other's homes at the moment, except for very specific exemptions like caring for a vulnerable person, for childcare, or if it is part of an extended household. When you do meet outdoors or in indoor public places, the maximum group size is 6 from a maximum of 2 households. Work from home if you can, download the Protect Scotland app, and finally, remember facts. Whatever other restrictions and rules and regulations are in place, it is compliance with facts that are the most important thing any of us can do. Wear face coverings whenever you're out and about. Avoid coming into contact with other people in crowded places. Clean your hands, clean hard surfaces, 2 metres distance you should be maintaining with people in other households, and self-isolate and get tested if you have the symptoms of COVID. Thank you for listening, and thank you for sticking with this. I am acutely aware every single day, not just as First Minister, but actually as a citizen, how horribly difficult this all is, and how all of us just want desperately for it to be over. It will be over soon, I hope. I can't tell you the date, but we will be looking back on it at some point soon. But right now, in order to get through it, we have to stick with all of this. We have to keep making the sacrifices, and remember that while these decisions are more difficult now than they have been because there are more things we have to balance, at the heart of this is still a very simple but very important imperative, which is to try to reduce the risk of people dying unnecessarily from a very nasty virus. So thank you very much for your patience and your forbearance and your sacrifice. And I'll now hand over to Jason.
Thank you, First Minister. I want to build briefly on the narrative about why October is different from March. Throughout March, culminating on the 23rd of March, like almost every one of the WHO member countries, 194 of them, Scotland brought down a fairly blunt hammer of what we now know as lockdown. Since May, we, like these 194 countries, have been trying to find a way out of lockdown. We've called ours a route map. It is different from the hammer. It's more informed, it's more evidence, but it is much, much harder. So let's think about what we know now that we didn't know on the 23rd of March, or we know more about than we knew on the 23rd of March. We know, for example, that outdoor transmission is significantly lower risk than indoor transmission. We know that children have a much milder course of disease than adults. We know that the key risk is transmission between households. We know now that if it gets into your household, it's very, very difficult for it not to sweep through all the members of that household. So the key risk is transmission between households. We know that mitigations done well and done properly can work to protect workers, patients, families, customers. We know that face coverings add a layer of protection. We know that ventilation indoors is more crucial than we thought. We know compliance, each of us, every single individual, we know compliance is crucial. We also know that the public have engaged and helped beyond anything that any of us could have hoped or imagined, partly because you understand the virus more than you did. We also know that the NHS and care systems have stepped up. We've invented, built from scratch, a test and protect system that now has tens of thousands of tests a day. It has a reliable contact tracing system, and it has a new app, which you should all download if you haven't done. We also have new treatments, mainly for those who are very unwell. You'll have heard us talk of the recovery trial and the discovery of dexamethasone at the edge of people who are really struggling with breathing or ventilated. But that's a significant advance to help us reduce mortality. But some things haven't changed. The virus hasn't changed in any significant way. The at-risk groups haven't really changed. They are still those over 80, over 70. They are the obese. They are those with pre-existing conditions. The need to protect the National Health Service hasn't changed. And the misery and grief of illness and death hasn't changed at all. 800 people got a positive test in the last 24 hours, with all of the anxiety that that causes. It is not March. We have so much more. But it is October, and we have to be vigilant.
Thanks, Jason. We've got a long list of questions today, as usual, so we'll crack on with them. First of all, Peter McMahon from ITV Border.
Thank you, First Minister. Just adjusting things here. First Minister, ITV Border today has talked to Stephen Leckie, who's the Chief Executive of the Hydro Group, including the Peebles Hydro. His view is that the first lockdown didn't work. We're back to square one. And he says this is our last chance to be busy before winter sets in. The next 5 months in the industry around Scotland, every hotel will lose money. This is our last chance to make some money, to put that away, to get them through the winter. Is there anything you can offer him and other people in the hospitality sector, particularly in the south of Scotland, to help them?
Hopefully some of what I've said today will give a degree of reassurance to people across different sectors of the economy. And hopefully the fact that we are carefully weighing all of these factors and thinking about economic impact and how we mitigate that will also give a degree of reassurance. I understand how horrendously difficult this is for people like Stephen, who's watched a business that has been built up with a lot of blood, sweat and tears over the years, struggle in the way so many businesses have. And I, like everybody does, find that heartbreaking. Like I find so many aspects of dealing with this pandemic utterly heartbreaking. I can't magic the virus away. I wish I could. I don't agree. I haven't seen all of Stephen's comments, so I hope I'm not in any way misrepresenting what he said. It's certainly not intended. The lockdown did work because it brought the virus from the very high levels we saw in March way down to the very low levels that we managed to get it through over the summer. But it came at a huge cost, and none of us want to go back there. And that's why we are having to find different ways to keep the virus under control while still living a lot more freely than we were under lockdown. And there's no magic formula for that. As I've been saying, there are things that we have now that we didn't have in March. And sometimes, and to some extent this is a good thing, we start to take them for granted. But we shouldn't. Test and protect right now is helping to do a lot of the work that lockdown did earlier in the year. So it is keeping, even although cases are rising, it is doing work that is difficult to quantify, actually, that is reducing the rate at which and the extent to which the virus is rising. Also, because we drove it down so low in the summer, the kind of increase we're seeing now, if that increase was happening on a much higher baseline, it would already have overwhelmed us and be out of control. So again, we are not there because we drove it down over the summer. And as Jason said, we know a lot more about how to stop it transmitting, even while we go about our daily lives. So we know that if we do everything that is recommended in facts, we can reduce the risks of transmission. But we have to do all of these things, and we have to keep working at persuading people and making sure compliance is as high as it needs to be. So there's lots that we have now that we didn't have then that allow us, I think, the prospect of keeping the virus under control but with a greater degree of freedom than we managed to have in March. But there is no country in the world right now, different countries are doing different things, but there's no country in the world right now that is able to control the virus without doing anything in order to keep it under control. And that's where we have to consider whether what we are doing is enough or whether we need to go further. And these are not easy decisions, but everybody can hear the numbers I'm reading out every day right now. And I know there is a sense, 7 months on, we're all about, fine, it's big numbers. But I've just announced today a hospitalisation figure that is 44 more than it was yesterday. When I stood here only 4 weeks ago, we only had 40 people in hospital with COVID. And now it's, well over 100 and rising rapidly. In fact, was it over 200 today? 262 people in hospital today. So this will eventually have the same toll that it had in March, which is people dying, becoming ill and having long-term health implications. We can't ignore that. It's about what balance we try to strike. And I'm trying to share with you today the factors we have to take account of. It's easy for all of us, including me, to say the things we don't want to do. It's much harder to decide the things we just have to do in order to try to minimise the toll that it is going to take. Do you want to add?
This may not give Mr. Leitch much comfort, but I can tell him that the advisor's room is not single-minded. It is not reduce COVID at all costs. The economic harms are public health linked. Unemployment, business closure, economic harm is a public health problem as well as a simple economic problem. So Mr. Leitch can be reassured that those conversations are broad, they are deep, they are long about what is the best advice to give to the decision makers. The other thing I would ask Mr. Leitch also to be aware of in the numbers, and as you see the rest of the country, there is an economic cost to doing nothing. It is not quite as simple as do these restrictions or don't do these restrictions. There will be an economic cost to coming back in another 6, 8 weeks, 3 months and saying, look, the numbers are now out of control. We're going to have to do more than we wanted to do in October.
Thanks. Glenn Campbell, BBC.
First Minister, given that some businesses are particularly concerned about the impact any new measures might have on them, if the action you're taking is for Scotland only, can you say clearly that your government will provide additional financial assistance to those businesses likely to be affected?
This is one of the factors that we are grappling with, because I I'm absolutely of the view if we take measures that have an economic impact, we have an obligation to financially mitigate to the best extent that we can. But we, as you've heard me say before, just as a statement of fact, we have finite resources. Discussions are ongoing with the UK government about how in the future all 4 nations that are having to take these kinds of decisions might be able to access additional funding. They have not concluded yet. I hope they will conclude positively. If we have to move more quickly than that, if that's the advice I get, then yes, we will be looking at what we can do within Scottish Government resources, and that will be part of, if we do take decisions today that I set out in Parliament tomorrow, how we intend to do that will be part of what I set out. Gordon Cree from STV.
Thank you, First Minister. You've talked a bit there about what you're not considering doing. I wonder if you could tell us a little more about what you are considering. And does this still fit into an elimination strategy, or are we now potentially locked into a reactive cycle of going in and out of restrictions as figures go up and down? And can I ask Professor Leitch, the hospitality industry, particularly pubs, are saying that if you look at the number of visits that have been to pubs since they reopened, the case numbers linked to them are very low. So what would the science be if further restrictions were to be imposed on hospitality?
I'll hand over to Jason on that particular point. It's an important and very legitimate question, which is obviously one of the things we look at carefully. Gordon, I hope you take this in the spirit it's intended. I'm trying to be as open and helpful as possible and reflect the state of decisions that Cabinet has reached. And we've reached some pretty firm conclusions this morning about the things we're not going to do. So I thought it was important to, instead of allowing speculation to continue, to set that out. We haven't reached final decisions on what we are going to do, and therefore I don't think it's neither possible nor would it be helpful for me to go much further in speculating. I think it's pretty obvious some of what we are having to consider, and it feeds into the question you've asked, Jason. What do we need to do to control this virus beyond, of course, what we are doing around the public health, the hygiene and facts messaging, test and protect? We need to limit the opportunities for the virus to spread. And we know, as Jason has set out, that one of the key ways that it spreads is gets into a household and it goes to everybody in the household. So if we don't limit household to household interaction, then it spreads from one household to another, and that's when it really runs out of control. So we have already tried to act on one of the biggest risk factors, and this is the toughest thing I think we'll ever do, of asking people not to visit each other's houses just now. And we see a similar restriction in many other parts of the UK. So if we are not sure that's enough, then we have to look at the other settings in which people are more likely to come together. And it doesn't always mean that it is because they are getting the infection in these settings, but if they have it elsewhere, where are they more likely to be coming into contact with large groups of other people where they could be passing it on? And that does bring into scope, and we haven't made final decisions, I want to keep stressing that, but it does, of course, bring into scope hospitality, because other than in our own homes, pubs, bars, restaurants, these are the kind of places, other than at our work, that we come into contact with other people. And yes, we have tried, and hospitality has worked very hard with us to do this, to limit the household-to-household risks there, but it is one of the other settings. So these are the kind of things that we just have to look at. But as we take these decisions, all of these different factors to try to come to a balanced view are very much what we are weighing up right now.
I wish I could point to every individual case in the country, all 800 today, and tell you where they caught the virus. That is impossible. No country can do that. The best we can do is interview the positive cases, ask them where they've been, try and gather themes. We can associate positive cases with areas, with activity, with behaviour. We cannot say this caused them to be positive. We know that around 40% it changes, sometimes 60, sometimes 35, say they've had social interaction of some description that goes beyond just workplace interactions and other parts of the puzzle. But if you were designing somewhere for the virus to spread, would it include a 1 metre distancing exemption, poorer ventilation, more crowds, alcohol, and a place where you could mix households? It's harsh, but yes, it probably would. And that's what some of hospitality looks like. So if I am asked by the First Minister, where is the risk, then I think it's in people's households, and I think it's other places where households mix. And that, of course, leads you into a conversation about what you can do with hospitality. But hospitality is not one homogenous thing. A daytime cafe for single parents and elderly people who come for their lunch that day is very different from the nighttime economy. So we have to be careful about that risk, but it is where households mix that is the risk.
Peter Smith from ITV.
Good afternoon, First Minister and Professor Leitch. And Professor Leitch, you cited there the number of countries around the world who adopted a lockdown as if we're in lockstep with many of them. In fact, there are many countries around the world where they were actually dealing with the virus almost immediately, particularly in the Asia Pacific and Oceania region. It was on their doorstep. This was a novel virus. They had no notice. We had about 2 months' notice to get things in order here. You look 10 months on, there are far fewer deaths in many of those countries. They had far fewer resources than us. And in general terms, life's getting back to much closer to what we would understand as normal than it is here. Offices are open, the economy's growing there again, certainly getting back to normal. Crowds are at sporting events and stadiums. 10 months on here, we have higher numbers of deaths. We have a perennial cycle of restrictions and lockdowns. We were in a prolonged period of about 4 months of one of the hardest lockdowns anywhere in the world for a very long period of time. 3 months of a softer lockdown with restrictions in place, and we seem to be unable to negotiate our way out of that. We're now talking about reimposing old restrictions. I just wonder, first of all, if you can explain why is it such different outcomes between us and some of these countries, and what can you do to tell people why we're going back to reimposing restrictions? What's going to be different this time? Because are we going to be using this time more effectively? Well, it's about bolstering.
Yeah, I know, but
what are you using this time for
okay.
that we didn't use it last time?
I'm not trying to, but we have a lot of questions to get through. So I know my answers are very long lengthy, so I'm the last person that should be complaining about the length of the questions. But I think again, I'll hand over. There's a question to Jason. The one thing I would say though, just before I hand over to Jason, is, we are not going back to where we were in March. If you think back then, we are living our lives much more normally than we were then and through the summer. Back in March, we shut all shops and, pretty much everything was shut. We were not allowed to leave our houses except to go to essential work. We're not going back there or anything like it. So, we have made progress. I didn't answer the question from Gordon about elimination. It is always our objective to drive the virus as low as possible. We don't think it's acceptable just to have a certain amount of virus and a certain amount of people dying. At different times that will pose different challenges, and as we came out of lockdown and into winter, it's posing a different challenge, but getting the virus to as low a level as possible continues to be our approach. But I'll hand over to Jason to take the main question.
The WHO have 6 regions, kind of continental, roughly the continents: Europe, Africa, the Americas. In 5 of those 6 regions, the virus is accelerating, including Asia Pacific. So the Asia Pacific region is not out of this. They did do very well at the beginning. They were used to SARS viruses, MERS viruses. They had testing, they had machines. They were, I think the WHO and others accept, they were more ready for a SARS virus than much of the Americas and all of Europe. However, the virus is still there. Hong Kong has been in and out of lockdown 3 or 4 times. Indonesia the same. New Zealand borders are closed. I spoke to some Australian colleagues yesterday morning. They've had 87,000 people in quarantine hotels for 2 weeks at their expense. So each country is making choices and decisions based on their demographic, their locality, their geography, and the state of the pandemic in their country. I'm talking to Singapore next week. We talk and try and learn from every country that is doing well, in inverted commas, and try and take those lessons and apply them to our situation. But Scotland is not Singapore. It's very different. We have bigger health inequalities. We live differently. Our geography is very different, not to state the obvious. And we try and apply the best of that learning from Germany, from Singapore, from Australia, to our situation. I wish it were easy just to find a poster child country, do what they've done, and everything would be fine. It just doesn't work like that.
Debbie Sridhar, who's obviously advising, has said that there's a choice. Closing borders is a really effective way. I appreciate you're limited in what you can do, First Minister, but I mean, if we can't close borders, fundamentally people are asking, what is the point of imposing more restrictions if we're going to be finding in 6 weeks, 8 weeks, we're reimposing them in and out? It's killing the economy. It's not getting us out of this virus. Where are we going?
Well, we're hopefully getting to a vaccine, we're hopefully getting to better treatments, we're hopefully getting out of this pandemic. I think we will be out of this pandemic, hopefully, well out of it by this time next year, although, it'd be daft of me particularly as a non-clinician to give absolute guarantees on these things. And we are learning to live with it more as we go. That doesn't mean life is 100% normal. And, New Zealand is in a very different geographical and economic position in terms of its trade and everything to Scotland, but it is not consequence-free to deal with the virus in the way that New Zealand is dealing with the virus. So different countries, based on circumstances, are making different choices, and we are learning to live with the virus more. So whatever conclusions we come to this week about extra restrictions, that is nothing like where we were earlier in the year, because we have built up a test and protect system that is doing work and doing well, and we will continue to build the resilience of that. And we are all learning in our everyday lives to try to minimise the risks. I think all of us, again, this is all of us, me included, I think we've gone through periods when it seemed to be abating, where we've perhaps maybe let things slip in terms of the compliance. So we all have to pick that up again. But we are living with this virus in a very different and more free way than we were earlier in the year. And I don't think it does the public debate any service to suggest that that is not the case. But it is a virus that is accelerating globally. And the idea that we can snap our fingers and have 100% normality in any country is not realistic. Alan Smith from Bauer.
Thank you, First Minister. NHS Lothian is reporting what it calls significant outbreaks among staff and residents at 2 care homes. The Health Board says a small number of residents of Redmill in West Lothian and Milford House in Edinburgh who've tested positive have died. More than 80 residents and staff have also tested positive. What is the Scottish Government aware of in regards to these outbreaks, and what support is being offered to these homes?
Jason may want to say a bit more. I'm not going to comment on specific homes right now because I don't have all of the detail in front of me. Obviously, we are kept updated on significant outbreaks all over the country in care homes or anywhere else. But we have taken and continue to take a range of measures, not least the testing programme in care homes, to firstly try to stop the virus getting into care homes, and then making sure that there is very robust infection prevention control in care homes. But that is the fact that we are seeing cases in care homes again is just another reason why we have to be very vigilant and not be complacent about the situation we're facing.
So I know only a little of these particular outbreaks. They came in our outbreak management report. I know that the relevant Scottish Government officials and the Cabinet Secretary for Health are engaged. They are talking to NHS Lothian if there's anything NHS Lothian need, but I'm very confident in NHS Lothian's test and protect system and the care home staff and everything that the Director of Public Health will be able to do there. The only other thing I would add on top of the First Minister's comment is that we know globally that care home outbreaks follow the community transmission. So if you have large numbers in your community, it becomes much more difficult to protect those at risk, which is exactly why we're thinking of doing extra things, and takes me back to the fact that the virus is the same virus that we've always had.
Fraser Knight from Global.
Thank you, First Minister. You said yesterday you had a Four Nations call with Michael Gove and with the other nations as well, talking about the current picture and the current restrictions. I understand you can't speak for other countries, but as you're kind of looking to bring in further restrictions here in Scotland, have the other nations signalled whether they're looking at similar kind of measures to bring in? Are you doing this alone, or is this something that there is cooperation on across the nations?
We're all looking at our own circumstances and acting appropriately. So there are many parts of England that already have tougher restrictions than we have in Scotland. There are many parts of Wales that already have tougher restrictions than we have in Scotland. So we're all responding to the situations that we're faced with. Northern Ireland, again, has very similar restrictions to Scotland, and I know we'll be considering, in light of the Republic of Ireland's decision last night, which took the country to a higher level of response, which involves, as I understand it, the closure of most of hospitality across the whole of the Republic of Ireland. So we all have to take the decisions we think are necessary. One thing we are trying to see if we can cooperate on and align our positions on is the UK government's working on this, and I've signalled that we are working on a similar thing, so we're going to see if we can come to some agreement. Is almost a sort of framework document, notwithstanding what we might do this week for the future, a framework of different levels of response depending on different levels of infection. So you could have different parts of one of the four nations or all of one of the four nations on a particular level. And we are keen, I think, if possible, where we will all take our own decisions about which levels the country or part of the country are at, is to see if we can align what those levels are and what the different measures within them might be. So that's discussion that is ongoing. Neil Pooran from PA.
Thanks, First Minister. On plans for a COVID vaccine, obviously we're still waiting for one to be found. You might have seen it was reported at the weekend that the UK government's head of vaccine task force said that less than 50% of the population could be expected to be vaccinated. Are these figures that you recognise? What sort of discussions are going on at the minute around a vaccine and how it will be distributed? And how will you come to decisions about what parts of the population would get a vaccine first?
To Jason on this, but what I say is we are guided in all decisions around vaccination and immunisation for all vaccines and by the JCVI, the Joint Committee on Vaccination and Immunisation, and they haven't yet, as I understand it as a non-clinician, it will be the type of vaccine that becomes available that will determine who it is most effective in, whether it needs 1 dose or 2 doses, and what sections of the population should be vaccinated. So we are planning as far as we can right now for how we would deliver a COVID vaccination programme, but we haven't had advice on, and therefore not yet been able to take decisions on exactly who in the population would be vaccinated and in what order.
Yeah, that's exactly right. We don't know what kind of vaccine we're going to get. Are we going to get first one that will just last for 3 months, maybe? Or are we going to get one that we think will last for a year? Or are we going to get one that gives lifelong immunity? Probably not. Are we going to give one that is safe for the over 80s or one that we think isn't safe for the over 80s? So there are so many unanswered questions that the research has to help us with, and it is moving at pace to be able to do that. And then there is a clinical piece of advice that will go to say, yes, we think we should vaccinate the vulnerable, if it's safe to do so, before we vaccinate the non-vulnerable, which is what we do with flu, of course. And then there's a logistic and a distribution and just getting it to people, which we're working on in parallel with the development of the vaccine. The other thing is there is a global push for this vaccine. The WHO got 150 countries to sign a pledge last week that it would be about a global vaccination programme to countries that simply can't afford to do what we'll be able to do. So there are huge variables in the vaccine distribution and development world.
Simon Johnson from The Telegraph.
Good afternoon, First Minister. First, we had obviously local lockdowns, then we had the national ban on visiting households indoors, but we've still seen cases going up, although I appreciate what you're saying that for that latter measure, they may not have fed through into the numbers yet. How confident are you that the additional restrictions you're considering will actually be effective in reducing the number of daily cases? How long would those measures have to be in place for them, the minimum period, for them to have an impact? And also, if I may, can I just ask you about the Daily Record story on Margaret Ferrier today? Would you like to see her now expelled from the SNP as soon as the party's processes allow, given she also visited a church to give a reading while symptomatic?
I've made my views on Margaret Ferrier very clear. I've nothing to add today. It would potentially compromise the due process of the party if I was to say what I thought the outcome of that would be before the consideration had happened. So that would not be in anybody's interest, and I'm, for that reason, not going to to do it. In terms of how confident I am that additional restrictions will make a difference, part of our decision making is to make sure we are, to the best of our ability, taking the decisions and doing the things that we think will have the biggest impact. And we do think that the household restrictions will have an impact. We've talked about this at briefings before. The household restrictions, of course, were in place in parts of the west of Scotland longer than they've been in place nationally. We do think they have blunted the increase, but the data is complicated by university outbreaks, so it makes it difficult to see. We have, and I'm not being complacent, and I'm not saying this in any way to suggest this is a competition or we're doing better than others. It's just a statement of fact. The rate of increase in Scotland since the modification of England's figures over the weekend is steep and steeper than we would want it to be, but our rate of increase over the past few weeks is not as great as is in other parts in the other 3 nations of the UK, which may suggest that some of the, we've got nationwide household restrictions, so maybe they are having an impact. So we can't ever be absolutely definitive about these things in advance. That's what makes this so difficult. But we try to target measures as effectively as we possibly can.
No, I don't think so. I think that's it.
Tom Martin from the...
The other measures have been in place many weeks, and when some of the talk about circuit breaker lockdowns, it's been 2 weeks, 3 weeks, whereas the previous measures you've announced have been in place for a lot longer than that. Will these additional restrictions have to be in place, do you think, longer than maybe some of the...
What I think the best thing for me to do, Simon, is, and this is just genuine, once we've taken those decisions today, and I'll set them out tomorrow, and I'll be able to give more clarity on that then. Anything else at the moment is obviously not uninformed speculation, because I know the decisions we are grappling with, but part of the difficulty here is all along is the more open I am about the things we're considering, the more that then feeds speculation about what we might do, and the speculation runs ahead of our decision making. I prefer that to being really closed about it and then just telling people when we've made a decision, but it's sometimes a tricky balance to strike, and sometimes I think it's better, particularly when we are getting close to actual decisions, to allow the decisions to be taken, given that I've set out the issues we're grappling with and set out the details of it at that point. Tom Martin from the Daily Express.
Hi, thank you, First Minister. You touched upon it in an earlier answer just about the need for compliance to continue to be high. But obviously there'll be a lot of people out there anxious, worried at the reimposition of certain restrictions or going backwards, who may just think, why are we bothering? Isn't there a sort of danger now of sort of compliance or patience starting to wear thin even more if more stuff's brought in?
Of course, there's a danger of all of this, and I suppose, I know how I feel as an individual. I'm sick and tired of COVID. Obviously, I'm sick and tired of it as First Minister. I'm sick and tired of it the way everybody is. I keep saying this. I'm not exempt from all of the restrictions everybody else is under. I'm coming into work every day, which not everybody is able to do, but I have not seen my family for 2 months, almost 3 months now. That's hard for all of us, and so I understand that, and I am fed up with it. So I know people are fed up with it, and it gets harder to stick with it. It really does. You start to think, well, why do we need to do this? But I'm afraid while we're still in this, like other countries, the only alternatives to sticking with it is allowing the thing to run out of control again, and we know that that's not a pleasant thing to deal with either. So I just have to appeal to people and try to be as open as I can be about why we're asking people to do certain things. I know that because we're not, yes, sometimes in any difficult journey, it can feel as if you take 2 steps forward and 1 step back. But, we are not going back to March this week. Absolutely not. We will have freedoms and continue to have freedoms that we didn't have back in March, April, May. And that's important. We have made progress. We've done lots of things along the way, Test and Protect being the obvious example of that. But this still takes effort. It still takes effort on the part of every one of us. And the more all of us comply with the basic things, then perhaps the less of the more difficult things we have to contemplate doing. And it's down to all of us. And that was true on day one, and it remains true today. Helen Puttock from The Times. Helen Puttock. If Helen is not there, I'll come back.
Hello, I'm here. I'm
sorry.
here. Thank you. Sorry for the delay. I wondered if I could ask about the delayed discharge figures, which are out today, which show a steadily rising level of delayed discharge, which looks like if it will continue, will go back to previous levels. Does that concern you, and what's the Scottish Government doing about it? I also noticed that A&E doctors have been expressing concern that bed numbers are down, and I wondered, given all those things, how confident you are going into winter with COVID that we have the hospital capacity we need to meet patient need. Thank you.
Well, that is an ongoing focus of the Health Secretary to make sure we have the capacity and that we have earmarked additional capacity for COVID. And of course, we have the Louisa Jordan, which is being used, even though it's not being used for COVID right now, but it is there as a contingency for COVID should we need it. On delayed discharge, we continue to want to get delayed discharge down and keep it down. I've said this many times over the period when we've been talking about the situation in care homes. It is not a good thing for older people to be in hospital when they don't need to be there. I'm not criticising this before people think I am. I'm just stating it. Much of the summer period, we've effectively been questioned on why we tried to get people out of hospital. And I know there are real issues and real questions there about care homes, but it is not a good thing for older people to be in hospital when they don't need to be. So work continues and will always continue with the Scottish Government to make sure we minimise that. You want to add?
Only about winter that ongoing meetings are happening all the time. The mobilisation group is meeting again, I think, this Friday with the Cabinet Secretary for Health to consider those winter plans. Every health board, every integrated joint board has winter plans. Winter is always challenging, and the extra layer of having to maintain capacity for COVID. Let me remind you, we had 800 new positives today. Some of them will need hospitalised in a few weeks' time. It's a lag indicator. We will have to keep capacity inside our health service for COVID cases. And that means winter is harder this year in planning and in the actual reality than it has been for some time.
Gina Davidson from the Scotsman.
Hi, thanks, First Minister. Lots of people have been delighted to hear today that you've said you're not going to halt the remobilisation of the NHS. The statistics out today have shown that the number of operations are something around like 50% below normal levels in August. And the Scottish Liberal Democrats, in fact, have said that 100,000 operations have now been lost to COVID. So I just wonder how you're going to manage dealing with the backlog of operations that are outstanding. And given that you mentioned the NHS Louisa Jordan in your previous answer, can I ask then, are you reconsidering the idea of closing it? Because that was reported just last week that it was going to be shut down.
Well, Louisa Jordan has always been intended to be temporary. What was reported last week is that we had entered into a contract for the eventual decommissioning. It wasn't that we were about to decommission it. Some time or other, it's not a permanent hospital. It will have to be decommissioned, but we have extended the lease. We have the ability, if we need to extend the lease again, and those decisions will depend on COVID. So it wasn't the case that because we were thinking ahead, as governments have to do, about how we decommission it when that is required, that meant we were about to close it early. So you're absolutely right. During COVID, other operations have been fewer in number because of not just the capacity needed in the health service for COVID, but the risks to patients of potentially being exposed to COVID. And while the numbers are, compared to the equivalent month last year, still lower, those numbers are rising again. So the recovery work and the backlog work is already underway, although it will take some time to complete. The Health Secretary, I think it might have been to you actually, I said that the Health Secretary was making a statement. I think I initially said it was going to be last week. I got that wrong about winter planning and remobilisation. I think that statement is now scheduled for the first week after the Parliament's October recess to set out the progress, the plans and the contingency work for winter that is underway. Christine Lavelle from The Sun.
Thank you, First Minister. Can you give us an update on how many of the 2,000 additional contact tracing staff you promised in May have been recruited and have actually started work? The Test and Protect system must be under a lot of strain at the moment. How is the system coping, and how do we know that you're not planning extra restrictions due to a failure to suppress the virus through Test and Protect?
Okay, I think for about the 22nd time in the last couple of weeks, let me just remind people of the 2,000 contact tracers commitment that was made. If you remember back earlier on, we said that we would create a pool of 2,000 contact tracers that would largely initially be created from the NHS redeploying people within its own resources. They wouldn't all be needed initially, but they would be there in a pool for people, for NHS boards to draw on. That pool of 2,000 is there. It is gradually being replaced by permanent newly recruited staff, and that process is underway. I'll provide figures when I can of exactly what the number of newly recruited staff is, but the pool of 2,000 has been there, it is there, and it is available for the NHS to draw on. We've also got the National Contact Tracing Centre, which is there to give health boards who are coming under pressure because they have outbreaks in their own area added support and resilience. Test and Protect is working extremely well. Yes, it's under pressure. Any system like that in a pandemic is going to be under pressure. But the figures for Test and Protect, remember the one issue we have had in recent weeks, which is the turnaround time of tests within the UK-wide system. That has improved, although we still monitor that very carefully. When Test and Protect pick up test results, though, their performance and the numbers they are contacting of index positive cases and the contacts of those cases is very, very good, well over 90%, and that is being done very quickly. So Test and Protect is working well and is taking a lot of the strain that back in the early part of the year we would have had to absorb through lockdown measures. As it gets more resilient, it will take even more of the strain, but no country just now is able to deal with COVID without some additional restrictions to keep the levels of the virus suppressed. Do you want to add anything about contact tracing?
Let's remember what Test and Protect is. Test and Protect is positive case index cases, 800 today. That's not everybody in the country who has the virus today. There are a large number of asymptomatic people who don't know they've got the virus, hence the reason for facts and distancing and hand washing. If it was just a matter of finding all the positive people and taking them off the streets, that would be a much easier task. Because of the incubation period of this particular virus of 7 to 10 to 14 days, Test and Protect can only act once you're positive. It can't act while you are incubating the virus. That's impossible. That's one of the reasons why we take the contacts also off the street and tell them to self-isolate. But there's no system in the world, no test available, no system in the world that can find all the asymptomatic positives in the country and protect us. That's why the first protection is our behaviour. The second protection is Test and Protect.
I think everybody knows what Jason means when he refers to taking people off the streets. It's not quite literal. David Ball from the Herald.
Thank you, First Minister. We've seen quite a steady rise in cases in the Lothian area in the last week or so. Do we know there's a trend behind that, such as the university population returning or hospitality, or is it down to just it being a large populated area? And also, the Scottish Human Rights Commission has suggested whether it was appropriate to let students return should be scrutinised by any future inquiry. I think Richard Leonard has written to you asking you to commit to that. I was just wondering if that is a part of the inquiry that you are able to commit to.
In my view, a public inquiry in the fullness of time should look at all aspects of pandemic handling, and to some extent it will be, we'll set a remit for the inquiry when we get to that point, but then it will be for the inquiry to decide what particular aspects they want to look at. And that is right and proper. I've never tried to say on anything that we are infallible. All governments have made mistakes, we've made mistakes, I've made mistakes. But I do think people should still consider that there are no risk-free options when you're dealing with a pandemic. There's no, 100% obviously right option and 100% obviously wrong option. Everything is a balance of harm. So take students, for example. Yes, bringing students back to university creates risks that we have to mitigate, but keeping all students away from university creates risks and harms as well, because you're depriving young people of anything approaching a normal educational experience. Those of us, as I keep saying, it's not yesterday for me, but those of us who've been at university know that a university experience is not just about the academic learning, it's not just about the lectures and tutorials, it's about the friends you make, the networks you make, the experiences you have around that. So, whatever you do in trying to mitigate the risk of a pandemic, and this is this is the hardest thing. It's the thing that weighs on my mind day and night, is you're doing somebody harm somewhere, but it's just about trying to minimise the overall harm you're doing. And it's not a particularly edifying position as a decision maker to be in, but that's the reality of it. And you had a first question that has gone completely out of my mind, so remind me what it was.
It's just
Lothian, I remember. Lothian. I'm going to hand over to Jason. I suspect it is a combination of all of the things you said. Urban, highly populated, densely populated area, university city, but obviously the sort of nightlife around Edinburgh will be having a factor there, but I'll hand over to Jason.
That's what we appear to be seeing. It did come a little bit later than the West, but it has caught up to some level. It's not as populous, so the numbers are lower than they are in the west of Scotland. We've seen roughly the same proportion of student outbreaks and student halls of residence. They are now diminishing in the main, and that leaves us with that underlying household gathering, inter-household mixing. And remember, when you have a bigger pool of positive cases, that takes longer to deal with. So the student population, it leaks into other populations around cities, around urban centres.
Thanks. David, my apologies, Derek Keeley from the Courier.
Thank you, First Minister. One of the concerns we've been hearing about is the damage any new measures could do to businesses, and whether a few weeks or months after they're lifted, we could just be back in the kind of same position we're in now. How confident are you that the restrictions you're planning will be able to have a meaningful long-term effect? And what are your goals while they're in place? Is it just about kind of breaking that cycle of transmission, or are you hoping to make other improvements, for example, to testing and contact tracing, which might help if those cases start to creep up again?
Jason, I want to say about this. So any kind of measures you're putting in, whether they're temporary or longer term, are about trying to reduce the rate at which the virus is spread, but also trying to reduce the overall number of people in the infectious pool in the country. As I've said before, and this has been an education for me over the past 7 months, and our number of over 1 is a big problem if it's on a very high baseline level of infection. It's still a problem on a lower level of infection, but it's a much less of a problem. So trying to bring both of these down. But also, with anything, of course, if you're putting measures in place, you've got to use any time that buys you productively. Test and Protect is working well, but we know we want to continue to build that, to expand its capacity, strengthen its resilience, look at how our testing strategy develops over the period. And, while given that a lot of this is about controlling the virus while still living as normally as we possibly can, it is also about making sure that we take the time to improve compliance, get the right messages across, make sure that the regulation that is in place for different sectors of the economy, that it's still fit for purpose. So it's not just about putting measures on to pause things, important though that is. It's about then using that time to do things that then further strengthen, hopefully, our ability to live with the virus even more normally than we are at the moment.
So the WHO say your number one priority should be to reduce the prevalence of the virus in your country. So that should be the number one thing you do. Now, of course, you have to do that in balance with all the other things we've talked about today. So that's what the restrictions are for. The restrictions are to reduce the number of people who die, who get sick, and who catch the virus. That's fairly fundamental. We are also in a race to get to the science. So if we can delay, then science will get us out of this. So on a more hopeful note, which I haven't been particularly today perhaps, we will get a vaccine, we will get better treatment, we will get different types of testing in the first half of next year. That's what the scientists are suggesting to us. So if we can live with it for longer, we will get to a longer term solution. We're not going to have to do this forever. We will get out of it.
Thanks. Rachel Watson from the Daily Mail.
Thank you, First Minister. And you spoke about speculation over what's going to happen earlier, but there's been a lot of talk about a circuit breaker for over a week now, and you've spoken yourself about wanting to take other measures potentially, but we're only getting an announcement tomorrow. Can I ask why it's taken so long to reach these decisions, and should it have been made earlier? And also, just on Simon's question about how long these restrictions could last, will any restrictions on businesses that are brought in, for example, if hospitality is required to close, Will that be done with the end of furlough in mind?
Look, the end of furlough, unfortunately, is happening regardless of anything, I think, although there's still time for the UK government to change its mind. So it can't be the only factor in our decisions. Of course, while it's there, businesses who are able to should take account of that. Why haven't we taken decisions quicker? Why don't we take them, on a timescale that, we try to take these decisions as quickly as we can, as clearly as we can, but they're not easy decisions. They're not black and white. And often we do need to analyse data for a period in order that we can be as clear as possible and as certain as possible we're taking the right decisions. And, we try to be open along the way. So we do discuss things that we are considering, even although we haven't taken decisions. And that, I know, then sets off speculation, which, we then have to try and deal with. But the alternative to that is I don't stand here at all and I just hide myself away in my office up on the 5th floor of this building, take the decisions and, pronounce them from on high every 3 weeks. And I don't think that's the right thing to do. So, we just have to try and share our decision-making process as we go. I wish these decisions were easier. I'm being First Minister is a privilege, and it's not a job anybody makes you do. It's my responsibility to take the tough decisions, not just the easy decisions. So I'm not saying this for any, woe is me kind of reasons, but these are horrendously difficult decisions. And as I said earlier on, they're the kind of decisions that whatever way you go, you will do harm somewhere. It is just about what is the best way of minimising the overall harm. And, I wouldn't wish these decisions on my worst enemy, to be perfectly honest, because they are not easy. They just happen to be my job to take at the moment, and I'm not complaining about that, although I recognise that I sound as if I am, so I'll stop. Do you want to add anything before I water on any longer?
No, I was going to say it's really difficult, Rachel, because when I'm asked on the TV, what is a circuit breaker? What would a circuit breaker do? I could either not go on TV to answer those questions, or I can try and inform the public about the nature of that, what the science tells us about that, what the pros and cons of that would be, and the advice we're trying to give inside this complexity. So I know people probably think I'm too open, perhaps, in the media interviews, but that's the intention. The intention is to let the public know the real challenge of these decisions. And I've been asked a dozen times in the last few days, what is a circuit breaker and what does it do? So I've tried to answer that. That doesn't mean we're going to do it. Sometimes that gets twisted into they're definitely thinking about a circuit breaker. That's not right. We're considering a host of options that the decision makers will then have to decide.
Muir Dickey from the Financial Times.
First Minister, can you give us a sense of what your experts are telling you about the factors behind the rise in infections in recent weeks? Which has been most important, for example? Has it been schools returning or universities returning? Have arrivals from other parts of the UK been a significant factor, or indeed travellers from overseas?
We've covered a lot of this today and in previous briefings. Jason will probably be able to answer this question a lot more clearly and articulately than I will, but it's a combination of these things. In simple terms, and remember I'm not a clinician or a public health expert, when everybody's locked down, the virus has nowhere to go, or it has fewer places to go. As we start to go about our daily lives again, it can merrily go about its way and do its damage. So as we start to mix again in all of these different settings you talk about, then that is what happens. What we do know is earlier, maybe a month, 6 weeks ago, and this is not surprising because of the summer holiday period, we had a much bigger contribution than we do now from travel coming into Scotland from overseas. That has reduced quite substantially. We know that schools going back, not because the virus is spreading in any significant way within schools, but because schools going back means that people are moving about more, parents taking kids to school, at the school gates, that kind of thing. Teachers obviously have their normal lives outside the school, so that creates more possibilities for spread. Universities coming back, that's another thing. And the type of places that in normal day-to-day life people congregate. And this is not saying it's their fault, because it's not hospitality's fault, but places like pubs and restaurants where people come together in groups. And so it's all of these things. But in terms of the themes, because as Jason said earlier on, it's not possible without genomic sequencing to know definitively where any one person actually got the virus. But what we know through the Test and Protect interviews is that for a period, although much less now, travel, household interactions, within domestic settings, hospitality, are the sort of key themes that come through from Test and Protect.
It's depressingly predictable. This virus, unfortunately, is depressingly predictable. If you open a sector, you get more cases. If you lock down like the 23rd of March, you get less cases. So if you open travel, you're going to get more cases. If you open schools, you're going to get more cases. If you open higher education, you're going to get more cases. Now, you make choices in there, you put mitigations around them, you protect them as much as you can, and I think that's exactly what Scotland and most of Europe has now proved you can do. You can open schools safely, but you have to mitigate against the harms from leaking out from that school. Same with further and higher education. We got numbers at the beginning. Now that appears to have settled. I saw a graph of the Glasgow University halls in the last few days, and those numbers have drifted down pretty dramatically over the last few days. So if you open another sector, you're going to get more cases until the science helps us out the other end of it. A lot of our outbreaks are still relatively small workplace outbreaks. We manage them. Test and Protect does its thing. So it's not one big answer. It's lots of little things.
And lastly today, Martin Hanna from the National.
Good afternoon, First Minister. Good afternoon, Professor. First Minister, I presume you're aware of the news this morning that the owner of a Manchester nightclub is taking the UK government to court, claiming that the 10 p.m. curfew may be illegal. I'm wondering, given our Four Nations approach, if the UK government loses the case, would you then have to scrap the 10 p.m. curfew here? And for Professor Leitch, one of the planks of the case is that he's asking that the health department down south show the evidence for the 10 p.m. curfew. Would you be prepared to do that were a similar case brought in Scotland?
I'm not actually aware of the basis of the case, so my apologies for that. I'm not able to comment on it in any detail. Obviously the outcome of that case, if there is a negative, from my perspective, or from the UK government's perspective, I should say, outcome of that case, of course that's something we would have to look at, but we have different legal systems in Scotland. Our regulations around coronavirus are, in many respects similar, but are not identical. So it would be, I think, not possible to draw absolute conclusions, particularly from a court case that sounds to me as if it's at a very early stage. And given that I don't know all the details of it, I probably shouldn't talk any more about it. But Jason?
So I won't talk about the legality or otherwise of the curfew. I think you could replay in the court one of the answers I gave earlier about how the virus spreads. So the virus spreads in poorly ventilated places that are close together, with alcohol, with mixings of households. That sounds, unfortunately, and I don't want the sector to be closed, that sounds like nightclubs to me.
Okay. Thank you very much to all the journalists who joined us today. Thanks to Anna for our BSL interpretation. Thanks to Jason for helping so well with the questions as usual. And thank you to all of you. I know there's a great deal of anxiety right now on top of all of the fatigue and general exasperation we all feel about COVID, about what might come next. And I don't mean to underplay the significance of what lies ahead of us in the weeks to come. But I do want to remind you that we're not going back to March. That is not on the table at the moment. And we have a lot more freedom, and we are determined to hang on to a lot more freedom than we did then. We are living more with this virus than we were then, and we want to continue to do that. But we still have to take measures to keep it under control. That's principally through our testing and contact tracing, but we all have to do other things to stop it really becoming the kind of problem it was for us earlier in the year. So it comes back to all of the things that we are asking you to do now. Don't visit each other's houses for the moment. Make sure that you are working from home if you can. Download the Protect Scotland app and follow all of the facts advice. And I will set out any conclusions the Cabinet reaches that impact on additional restrictions in the Scottish Parliament tomorrow. My understanding is that statement tomorrow in Parliament will be around 3 o'clock, although you'll be able to find details of that on the Scottish Parliament website. As a result of that, I will not be here at 12:15 tomorrow, but or on Thursday, because we'll be in Parliament again on Thursday. And on the current schedule, I will see you back here on Friday at 12:15. But thanks very much, not just for joining us today, but for all the sacrifices you continue to make. Thank you.